Dear friends and colleagues in global health, my name is Jeanette Magnus, and I am the director of the Center for Global Health at the University of Oslo. The Center for Global Health is an initiative of the Faculty of Medicine as part of the 2030 agenda to meet the SDGs, the Sustainable Development Goals. SDG number 9 includes an aim to, I quote, significantly increase access to information computer technology and strive to provide universal and affordable access to the internet in least developed countries by 2020. The internet would also be essential for the implementation and monitoring of the SDGs. The next step will be to see how the goals can become a reality in an increasingly digitalized world. Today, we will celebrate our new digital global health cross-cutting theme at the Center for Global Health here at the University of Oslo. On behalf of the Center, I am excited to welcome you to this webinar and to introduce Professor Joseph Knoll, who will lead the digital cross-cutting theme and be our moderator for this session today. Since joining the University of Oslo as professor in 2005, following his career at Siemens, Telenor, European Space Agency, Professor Knoll has worked on digital transformation, including digital tools for health projects. And in 2014, he initiated the Basic Internet Foundation to focus on connecting the unconnected. Lack of access to the internet compounds access to health information. Today, Joseph Knoll will be our moderator and introduce us to an impressive panel of speakers. Please, Professor Knoll, the floor is yours.
Thank you so much, Professor Magnus. I am very pleased to be invited to be the moderator today, but I want to put the focus on our eminent speaker, and I will just announce our eminent speaker. But before we do that, I'd like to mention some few rules for this event. When you registered, you actually agreed that we can record and make the link available, such that those who can't join now can still look at the webinar afterwards. The second point is the webinar will have short presentations of 4 short presentations and then having a long time for discussions. During these discussions, please use the Q&A session, post the questions. What we'll do is the questions which we can't answer now, we'll answer afterwards on the webpage. And by that one, I want to welcome you all to the webinar on resilient communities, digital transformation. How can we empower the societies? And the digital transformation is really reaching out to most of the sectors, especially the industry when it comes to service delivery, when it comes to efficiency and effectiveness. And what we have seen, of course, is that COVID-19 has boosted the digital transformation of the educational sector. When it comes to health, we see the eminent capability of digital health when it comes to health information systems. And I'm very happy having with us Arunima Segal Mukherjee from the DEHIS2 platform, which is present in more than 100 countries, and she can tell a bit more about the experience. The second part, which we want to focus on, is sensors and integrated diagnostics, which give us so many more capabilities, of course, given that we reach out with the sensors and the devices to where they're needed. The third one is the area of big data, which gives us a huge of opportunities together with artificial intelligence to actually get new knowledge out from the data we collect. And the fourth part I want to bring across is digital health promotion and the community involvement, one of the areas where Christine Holst can present the experience from Tanzania. So at the end of the day, the digital transformation can really help us all to bring health to a new level and hopefully reach out to every single human when it comes. And by that one, I'd love to introduce Kristin Sverdrup from the Norwegian Ministry for Foreign Affairs. Unfortunately, Kristin got sick and couldn't join. So this morning, she said, I'm very sorry, I can't join. But Kristin has such an important role at the Ministry of Foreign Affairs. She was the co-author of the governmental white paper on digital transformation and development policy, and has like 24 years in developing cooperation, foreign services, working for Norway's implementation all over the world, in Brussels, Tanzania, Malawi, Sudan. So Kristin has really the fantastic view, and she is pushing the role of Norway in promoting digital public goods. As Kristin couldn't make it today due to sickness, we have the pleasure that Jeanette is just reading the slides so that you know what the message should have been. And I hope that at one point in time, we can follow up with Kristin live here at this stage. So I give the word to Jeanette to present on behalf of Kristin Sverdrup.
As mentioned, digital public goods is what the topic is about. And there is a Digital Public Goods Alliance where the Ministry of Foreign Affairs in Norway is partners together with UNICEF and IS Spirit, and it was established in 2019 to accelerate attainment of the Sustainable Development Goals in low and middle income countries, to facilitate the discovery, development, use of and investment in digital public goods. And then the question is, what are digital public goods? It's a project or product that conforms to the definition of digital public goods is laid out by the UN Secretary General in 2020 Roadmap for Digital Cooperation. It's an open source software, open data, open artificial intelligence models, open standards, and open content that adhere to privacy and other applicable laws and best practices, do no harm, and help attain the Sustainable Development Goals. The Digital Public Goods Standards is focused on advancing these Sustainable Development Goals, open source, and do not harm. The others we can see listed here in the slide. There is a registry available, and where different digital public goods systems can be nominated, and out of more than 586, 24 has been accepted. And we can see here on the slide how the green related to good health and well-being is far the largest area. And so this is very important for health. So the world's largest health information management system is developed through collaboration led by the University of Oslo, the District Health Information System, version 2. And it started in post-apartheid South Africa and is now a global open source project coordinated by HISP at the University of Oslo. More than 73 countries worldwide use DHS for collecting and analyzing health data, including non-government actors in over 100 countries. So 30% of the world's population live in countries where DHS is used. It's offered free of charge as a global public good. They have also recently developed tools for COVID-19 surveillance and vaccine delivery, and it was already in March 2020. It's been used through Asia, Africa, and Latin America. And also there is vaccine plans, installable metadata packages, facilitating the uptake of global data standards in National Health Management Information System. And the team provides technical guidelines, guidance, implementation guides, demo databases, and training materials, provide all the resources a country needs to hit the ground running and implement fit-for-purpose solution to curb the pandemic. Please visit their website. Another one is the modular open source identity platform, the MOSIP. More than a billion people in the world have no personal identification. 3 billion have paper identification. And 50% of people without identification lives in sub-Saharan Africa. Its marginalized groups are overrepresented among these. India has been in the forefront to solve the 3 economic bases of identity, payment, and data for over the last 10 years. And the International Institute of Information Technology in Bangalore is anchoring the MOSIP project as a digital public good. It's a modular and open source identity platform that helps governments implement a digital foundational information personalized ID in a cost-effective way while embracing the best practice of scalability, security, and privacy, harnessing the power of open source. In action, we have seen that there are several countries that have signed MOUs with MOSIP. The partners are coming on board, and digital ID can secure access to health and social services, emergency support during crises, such as the ongoing COVID-19 pandemic. It can register businesses, fight against modern slavery. It can support financial inclusion, and it is vital for strengthening democracies as people can enter voter registries and stand for election. Improving national demographic data and statistics can lead to better policy choices. Then we have the learning technologies as digital public goods. So even before the pandemic hit, more than half of all children in low and middle income countries were unable to read and understand simple stories by the end of primary school. Many children do not have access to reading books in a language they use and understand. The Global Digital Library is the flagship initiative of the Global Book Alliance, funded and managed by Norway. Thousands of books have been translated into more than 100 languages over the past year. Norway's innovation competition EDU app for Syria sourced 2 open source smartphone applications with the aim of helping Syrian children learn how to read in Arabic and improve their psychosocial well-being. Feed the Monster, the name of this app, one of these apps, is available now in 45 languages. And an evaluation in a camp in Jordan showed that children using these games strengthen their reading skills with 50% compared to control group. All the games are funded as part of the EDU app for Syria project, have open source licenses to encourage maximum use and further creativity. So please visit Feed the Monsters and learn more about it. The Alliance is currently exploring to acquire a top-level domain for digital public goods. It needs to increase the access to the digital public goods, facilitating the exchange of value and funds and the safe engagement of new communities in the use, creation, and maintenance of digital public goods. Such a platform will be cookie-free, trash-free, safe, and quality assured. The key lessons learned up until now is that there needs to be a long-term commitment. We need to avoid death by piloting, ensure interoperability, and we must think scale up from the start. We need to avoid fragmentation and competition among the funders. Have a community of experts and tech teams to back up organizations and countries wanting to roll out solutions. We also need to think about multi-purposes thinking. So DHS is now being tested for the education sector. More focus on cybersecurity is important. Most of our partner countries scores extremely low on cyber maturity. So it takes a village to raise a child. It takes a global village to create and roll out digital public goods. We have to work together. Please visit some of these links to familiarize yourself with these. Thank you.
Thank you, Professor Magnus, for taking the words and the slides from Director Christine Sverdrup. I don't want to put, we don't put questions up now, but please write your questions in the Q&A. We will have a short change in program due to technology. So our second speaker is Kim Gabrielli, who is Executive Director of the UN Global Compact in Norway. Kim Gabrielli was formerly the Deputy Executive Director of the UN Children's Fund, UNICEF Norway, and worked at UNICEF headquarters in New York and as international advisor of the President of the Norwegian Olympic Committee. He was chosen one of the top 10 young sustainable business leaders by the business newspapers E24 in 2011. He is also podcast host of The Business of the Future. And Kim will present for us the sustainability and digital transformation as a business opportunity. The floor is yours, Director Kim Gabrielli.
Thank you so much, Joseph. I will share my presentation in a second. I just wanted to say hi to everyone out there first, and then I will try to give a bit different perspective on this area. So just give me a second. Okay, everyone. So I wanted to talk about Transformation 2030 in a sort of the big picture in a way. The reason for that is we have already heard some really good examples on how to work on, from the public side, on how to create with development funding and also with new systems, new ways of working on global health. So I'm not going to go too deep into global health, which has been something I've been working on for several years in UNICEF, which is one of the largest UN organization and development organizations on the world, also in the area of health. But I wanted to start out to see how can we scale up these ideas? How can we bring in what is already being done by development policy into more normal business? Because if we look at the big picture, I usually say that the SDGs are the largest business opportunity of our time. So what do I mean by that? The fact is that we have 17 goals that basically sums up all the problems in the world. And what do companies do? They solve problems of the humanity and hopefully also of the climate and the planet in order to earn money, right? So here we have a very good description of that. And if we look at the market opportunities, there are different numbers, but one number is used by this report here, Better Business, Better Future. It's 12 trillion USD per year until 2030. I think we all don't really know what 12 trillion is, but what we certainly know is that it's a huge opportunity. And a lot of opportunities, as you see on the screen now, within many areas on how to earn money. And why is this important? Why is value creation and job creation important? Because one of the strongest muscles and motivations of the world we're living in is the economical motivation that companies have, that finance actors have, but also that consumers and others are driving. So my point in this presentation to say we really need to reuse that muscle, and we are not using it well enough today. If we look at what are the trends in business, if we look to the Norwegian Employee Association, the Confederation of Enterprise, NHO, they are in their roadmap towards 2030, concluding that there are four trends that we're seeing. Of course, we need a greener, and everything is moving towards a greener economy. We see that it's becoming more international. We see that Norway is lacking behind, for example, on export, and that's something we are pushing, but many other countries are pushing that as well. We see a more circular or more service-based world and economy, and not least, we see as a fourth trend and opportunity, we see that it's more digital. But we also see that there, what is business in the big picture? What is it really about? We in the UN Global Compact, the UN Organization for Sustainable Business, we do say that there is no choice. So the future of business is sustainable. So we are not talking about sustainable business, but we are talking about the future of business. And there are many things about this, from the internet access that is a specific focus for this seminar, but also decent work, economic growth, etc., that are split up in dilemmas and opportunities throughout the SDGs. But if you want to simplify it, there's two areas of sustainable and future business. On one side is the do not harm perspective. So let's keep to the rules, let's make better rules, let's have a responsible business. What we call, with the theory of NHH and Jørgensen and Pedersen, the shadow side. So where there's potential a conflict between the interests of the planet and the people and the work of a company. That we need to work on. And Norway has done some things in the foreign policy on this, and development policy have had a focus, but there is much need for more. On the other side, we have the sort of win-win solution, where you can increase value creation and jobs, and at the same time deliver results for people and planet. And that is what we actually see these days, that green industry opportunities are trending. It's of course not an easy thing, but this is an area where we see that how can we make sure that we create business opportunities in Africa, for example, that is also delivering more digitalization to the people. We have seen more and more initiative by the Norwegian government. So one of the examples here, Digital Public Goods Alliance, is such an example of bringing actors together and defining what is the public goods, and also taking the next step to what are the kind of programs we need. That was already mentioned. But we see a big lack, not only in Norwegian foreign policy, but also beyond. We see that there is more focus than ever before on tax, on responsible business. Here the example of FACTI, the Financial Accountability, Transparency and Integrity panel that Norway was part of and took a very essential role to establish. It's great that Norway is taking on this role. But we also do see that on the other side, on how to finance, how to get the products that were mentioned, digital products, into the market, how to balance the challenge, the dilemmas that this is full of, how to give more digitalization and more new products and services to the people, but at the same time make sure that there is no do not harm and a responsible business perspective. That is a challenge. And we see that, while other countries have had a focus on green finance, on digital finance, on other areas of scale up of SMEs in development countries, that perspective hasn't been very deep in the Norwegian foreign policy, for example. If you look to other countries, there are better examples. We got a news yesterday or the day before that oil for development is changed into energy for development. And this sort of, how do we invest in digitalization? I think it is a very important perspective. And the second thing with regards to this is that we have to turn it the other way around as well. When I was working in UNICEF, we used to say that the developing countries will develop the world. What did we mean by that? We meant that some of the simplest and genius ideas come from areas where they don't have all the technology that we have. A new way of using SMS, for example, and mobile technology, like mobile cash, came from Safaricom, right? Our new executive director, Sanda Ubiayo, she used to be the sustainable director of sustainable affairs in Safaricom. So for us, it's also about how can we learn from all the great things that are going on in digitalization in Africa, Asia, and other continents than our own. So to conclude, we are very much happy about the new development, for example, that we see in other countries, but also what we see now when NORAD is taking a step towards a new strategy where there's a lot of focus on partnership with business, because we know there are issues, we know there are dilemmas, but we, as the largest network of sustainability network for companies in Norway, we are prepared to enter into dialogue with UNICEF, yes, but also with NORAD more and more. And I think that to look at the strategic investment, that is the first priority of the new NORAD strategy, and also look at how do you deepen partnerships with finance and business is a key area if you want to work more on green business, more on digital business, service-based, as well as international cooperation. So with those words, I would like to say thank you so much, and happy to go into the further discussion later on.
Thank you so much, Kim. I loved your words about digitization and that we call it energy for development. But we'll come back to that one, I would guess. I now have the pleasure to invite Paul Richard Pfeiffer, who is director at the Department for Human Development at the Norwegian Agency for Development Cooperation, NORAD. Paul is actually a real medical doctor. He did his Master of Science in Public Policy and Management and has worked over 30 years in international development work, initially focusing on vaccines and global health. And I think that is still one of the babies which Paul loves. He has worked at UNICEF in Eritrea, Cambodia, and at the New York headquarters. And since 2004, he is with NORAD. And he is now overseeing global health, education, human rights, gender equality, as well as higher education and research. After some technical issues, Paul, I'm very happy that you can jump in and present the digital inclusion and transformation for achieving the SDGs. The floor is yours, Director Paul Pfeiffer.
It's a pleasure being here. I'm very sorry, very sorry also to hear that Kristin Sverdrup was not able to introduce, but I was told that you were able to go through some of the key messages and the slides, and I heard, Kim, the last part of your presentation, so it's a pleasure being here. So, these are special times for many reasons. One of the special times is that we are, in the midst of a change in government, so it's clear that all the strategies and, shall we say, the directions we've seen the past years, it's clear a new government will be coming in. We guess in mid-October, second half of October. But I must say that I cannot imagine that the emphasis on digitalization and innovation and transformative ways of doing development is going to change. So it's very clear that, and I think that was said by both what Kristin would have said and also what I heard Kim say, that the Norwegian government has really, shall we say, for several years worked in different ways, so that Norway can contribute, shall we say, to decrease the digital divide that we see. Very much shall we say, increasing the opportunities that we see through digital solutions, but also being quite aware of the pitfalls. So NORAD is a directorate reporting to the Ministry of Foreign Affairs, and also when it comes to the Climate and Forestry project, to the Ministry for the Climate and the Environment. And we work as part of government with a range of shall we say, sister agencies and other ministries also. And what we see as one of, shall we say, of the cross-cutting, shall we say, themes which are coming up, basically everything we do is the issue of shall we say, connectivity, digital solutions, both in terms of how we can improve our own way of doing business, but not least, shall we say, for opening up for new opportunities for more people. So we have a new strategy, like Kim mentioned. Our new director, which came on board last year, Bård Vegar Solhjell, is a well-known politician and has been both Ministry of Education and Ministry of Climate. And the environment. And it's very clear that we've been looking towards 2030, and this is a strategy that is not a thematic strategy. The themes and the priorities are set by Norwegian government, but it's basically a strategy on how we're going to do better or even better. After reorganization and a change, shall we say, or specification or division of labor, Norway is now managing 20 billion Norwegian kroner per year, which is quite significant in terms of, shall we say, monies just in themselves, but also, I mean, it's clear it raises the question of how can we best make use of that funding to basically deliver on the joint priorities of the SDGs and Agenda 2030 and leaving no one behind, but also increasingly what we see as, shall we say, not only combating poverty and reducing inequality, but also very clearly working towards shall we say, a more sustainable development focusing on nature and the climate crisis. So it is both very tough and exciting times. I mean, the General Assembly is basically taking place this week. We have the COP26 and Glasgow coming up at the end of the year. We have similarly, I mean, the big nature summit next year, and we just see that the number of crises are, shall we say, increasing, both in terms of humanitarian issues that we also know very clearly are shall we say, priorities, and these need to be seen in conjunction very clearly. So, and I mean, it's starting to get a bit tired of saying we have to do more with less, but that's the reality. And it's very clear that digital solutions and changing the way we work, interact, opening up for opportunities for new partnership and including, shall we say, more people, not least young people, to basically be able to reap the opportunities that we now take for granted is something that we're very much aware of. In the strategy, we have several priorities. It's very clearly a strategic use of the funding that basically we receive from the ministry and that we need to put to work, like one likes to say. It's very clear also that we want to become a champion in innovation for development cooperation. And as part of this innovation thrust, it's both innovation in terms of, shall we say, working in new ways and so on, but we do see that digitalization and is basically one area where we have been able, shall we say, to do quite a lot these past years, including in health, increasing in education, and also, like Kristin had in a presentation around digital public goods. But we very much want, I mean, to redouble our efforts. We think it's terribly exciting to see that the university and the Center for Global Health has chosen, I mean, to establish a cross-cutting theme. And I mean, we use also this opportunity, shall we say, to better understand what is academia doing. We talked about private sector. We do see from the public sector side a deep responsibility in the Nordic tradition, shall we say, in terms of safeguarding opportunities and basically being perhaps not in the driving seat. I cannot, shall we say, pretend that public sector always is pushing for the big, shall we say, innovations, but very clearly, shall we say, having a steward role and encouraging what we've been doing for some time, but really seeking for new partnership, private sector, academia, government, and not least also, I would say, civil society. We see a lot of innovation happening, shall we say, in the civil society realm, both, I mean, in the Norwegian sphere, but also, I mean, as part of the international work. I need to say that coupled with, shall we say, an increase in interest in digital solutions, we do see, and that is well known, that there are pitfalls. It's very clear we do want, shall we say, to safeguard democracy. We really want to push for human rights. And we see that we are globally in a place where actually there is a setback on civil society, on space, on political space, and basic freedom of expression in an increasing number of countries. And that translates, shall we say, very clearly into how it plays into, shall we say, both access to infrastructure, but also in terms of content. So I would like to say that in addition to radically changing the way that we work, we would like to put an emphasis on local issues, on basically contributing to developing systems, supporting infrastructure, but very clearly supporting content that is relevant and that can be adapted at local level. We do see that that is both extremely, shall we, satisfying to see that several countries in the global south are actually leading, shall we say. I do think the examples on early COVID-19 pandemic days, as part of the IHS2 HISP network that is hosted by the University of Oslo, but I mean works in networks with more than 100 countries, realizing that it was the Sri Lanka node that basically came up with, shall we say, an early, shall we say, ideas and developed, shall we say, tools that could be used in the pandemic response. That was not surprising, first of all, but it was really satisfying to see that, I mean, leadership comes from everywhere today. It is not, shall we say, a northern. Things have changed, so it's very clear that we also are working here within a very different environment from just 10 years ago, 15 years ago, where we also need to see this discussion as part of democratization and decolonialization. If I can learn to pronounce it, I shouldn't. So skills enhancement is one area where I do think the universities and, shall we say, everyone has a responsibility. One of the preconditions for being able, shall we say, to fully reap the opportunities and take actively part in society is not only access, but also the skills, shall we say, to make use of technology, of, shall we say, social innovations. And maybe I should also, I don't know, Kristin's presentation talked about the Alliance for Digital Public Goods. Perhaps I'll come back to that a bit later if there's an opportunity. But we do see that there are issues around legal, shall we say, barriers. We do see, and we are really pushing for open source, basically, democratization of the technology, and we do see that we do need to work with the private sector in good partnerships. But there are also commercial interests. I'll be very open about it, and that we think that these are issues in the political economy that we need to be aware of and work with and work around sometimes to be able, shall we say, to expand access and use. My last point here, Joseph, would be actually that we are based in Norway. I mean, I represent the Norwegian government. We do see, and going back to the SDGs, and that they basically account, I mean, they are relevant for all countries. We do have a tradition in the Nordic countries in Norway where the public sector, where government in partnership, in broad partnerships, really both uses public resources for public goods, but also we have in some sectors, shall we say, very good. I mean, we have very good examples where we have succeeded, but we do see that the basic development we see in our country, in our, shall we say, close everyday life, actually inspires us, shall we say, to seek for not similar, but at least opportunities that actually should be the rights of everyone else to be able to use. And we also see that this goes both ways. So it's clear an interdependency and a huge opportunity for learning also. So there are so many things here. I think I'll stop here and then I'll join in the discussion a bit later. Thank you so much.
Thank you so much, Director Paul Pfeiffer. And you really warmed my heart when you said that it's about digital solution partnership, and it's about the young people, and it's the skills development which we have. And I'd like to take that opportunity to introduce our researchers here at the university, Arunima, Segal, Mukherjee. She works as a postdoctoral fellow at the Health Information Systems, HIS2, as you all mentioned, at the Department for Informatics. Tom Neumark is also postdoctoral fellow at the Institute for Health and Society and the Center for Development and Environment, SUM, at the University of Oslo. And third is Christine Holst, who is a doctoral research fellow at the Center for Global Health, at the Department of Community Medicine and Global Health, and at the Institute for Health and Society. And I leave the floor to our young researchers to introduce their work and then start the discussion. And I will only note the discussion, so please, Arunima, Tom, and Christina, the floor is yours.
Thanks, Joseph. Thank you so much. And thanks to everyone for such an interesting, insightful discussion. So for three of us, researchers at the university and coming from different domains, working with the digital and the health. So we bring in the perspectives which we thought, throwing questions to the expert panel and to the audience for comments and making a richer discussion. So myself, I come from informatics, public health informatics domain. And so like Paul said, so yes, working with the DHIS2 and in countries. So I come from India and I've been working a lot in South Asia, India, of course, South Asia and East Africa. So that's where I've worked. So engaging more and more with the digital solutions within health systems. So what I think the questions I would like to bring into discussion here is multidisciplinarity. So, so the questions I would like to pose to the experts is, how can multidisciplinary research in global health enable understanding of digital transformation? This specifically, given that we're coming out with a very, very interesting initiative of having a center for digital health, having a research group specifically for digital health. So multidisciplinarity, I think, is just so crucial to it. I mean, I'll just come to you what I mean from my empirical example. Tom, if you could please go ahead. Yeah, thanks. So this is one of the sites which we all must have witnessed on the television with the second strong COVID wave in India, with people with critical care, oxygen supplies just not available, people trying to find out ways, how do we get, so of course this what we see is a very frugal kind of way of sharing oxygen supply. Yes, yes, Tom, please. Yeah, and so, if this is the context, so then I think what do we need to understand this context? Of course, we need the clinical, there's a whole lot of clinical information. There's a clinical knowledge of why oxygen in this for critical patient. And then there's also the whole context of health systems, capacity of health system, what happens, then the local practices, there is population demographics, there's infrastructure. So there's a whole lot of contextual understanding that we need to deal with this information, deal with this situation. Tom, please, next. Yeah, next, yeah. And so one of the ways we dealt with this was, if you see, this is what we call the oxygen war room in Kerala. So this is that thing where, so how digital partnered with the situation to deal with it. Yes, Paul, Tom, please, next. So in this, of course, there's a digital solution to address this specific problem, but what it needs, and of course, different parameters which need to be monitored. There is predictive modeling, there's spatial, there is also how do you use this data for policy interventions. So while I think what we've all discussed is that there is a commitment for looking at possibilities of having digital as a solution. But then I think there is very specific, there is a deep learning here of multidisciplinarity, because myself coming from within the domain where we work with the technical solutions, I think we would all benefit a lot if it is much more multidisciplinary. If we have learnings also engaging, I mean, when we come up with something like this from this, let's say from the global health, from development studies, from anthropology, it makes much more meaningful. And then the whole question of what and for whom. I think, yeah, so that's what the question I'm going to raise. I'll pass it on to Christina, please. Christina, over to you.
Thank you very much, Arunima. Yes, I will echo what has already been said. Thank you so much for a very interesting point of views today. And thank you very much for having me in this session. My name is Christina Holst. I'm about to wrap up my PhD thesis on the effect and use of a digital health education intervention for individuals and communities in rural Tanzania. Since I have limited time here today, and the point is to show you how a digital intervention can improve health knowledge, leading to increased health literacy, which is the main goal of such education. I want to very quickly show you a collage of what we have been doing in Tanzania in this digital health project that I was part of last year, called Non-Discriminating Access for Digital Inclusion. Next slide, please. So together with this multidisciplinary team and multinational team, we developed a digital health education intervention for rural Tanzanians. The intervention consisted of showing the participants in the intervention group 3 animations on a tablet with basic information related to HIV, TB, and a neglected tropical disease and zoonosis called pork tapeworm and cysticercosis. And later on, the same group got access to a digital health platform in local information spots that we installed in the DG project. And this platform contained the same animations, but also extended health education content for in local language, of course. Then we conducted a non-randomized controlled study with 600 participants altogether, 300 in each group, and we assessed the health knowledge in both groups at baseline, 3 months past baseline, and 12 months after baseline. In addition, we undertook 35 semi-structured interviews with users and non-users of these info spots and the digital health platform. Our results show that the animations really improved health knowledge in the intervention group. We found 10 to 12% higher mean average proportion of correct answers related to HIV and TB in the intervention group compared to the control group, and we found over 30% higher mean proportion correct answers related to the neglected tropical disease, pork tapeworm, and cysticercosis. And this was 12 months after showing the animations and 6 months after giving the voluntarily free access to the information spots with the health platform. Further, we saw that the participants who actually accessed the health platform, again, they would raise their health knowledge with about 7 to 14% over those who did not access these information, the health platform, really, the digital platform. In the qualitative interviews, we found really variations between use patterns among the users. We found that students, health workers, teachers, village leaders, they will use the platform in a really advanced way, utilizing the health content for their own and for educating others in health. We saw also examples of unintended use of the platform. For example, students practicing English by switching language between Swahili and English with the animations. And we also saw that teachers used the platform to prepare for class, and health workers used the tablets with the animations on outreach to educate others. But we also found that quite a few people in the rural communities had difficulties accessing the platform with the available tablets that we provided. As this group lacked the digital skills, the guiding from other users with more advanced digital skills were crucial for their uptake of the health information. And that was very interesting to see. We experienced that the people were really enthusiastic and positive towards learning from digital platforms. And all participants, non-users and non-users of the platform, perceived the animations as an effective knowledge transfer tool. And this content in the animations was obviously developed in Tanzania with own language and recognizable environment and characters. My point with this presentation is I think perhaps the most affordable form of disease prevention is quality health education for individuals and communities, leading to increased health literacy, which is relevant for several sustainable development goals. Access to basic health education should be, if not a human right, at least a big part of the digital public goods. I want to ask today how we can ensure that people in the Global South get both access to quality digital health education and how we can ensure that all people have the required skills to use such digital sources for health. I also want to ask how we can create a digital partnership for digital health promotion globally. Thank you very much, and I pass this on to Tom. Tom, please.
Great. Thanks, Christine. Great. Hi, everyone. I'll jump in because we don't have much time. I'm a social anthropologist. I've been living and carrying out fieldwork in East Africa since around 2005. My current research is part of a European Research Council funded project called Universal Health Coverage in Africa. And I'll come on to that research in a minute. I just want to talk or mention something that might be interesting to participants, which is a recent special issue that's been edited by some colleagues of mine in the journal Global Policy. And this came out of the Lancet's University of Oslo Commission on Global Governance for Health. And this is on digital technology and particularly the political dimensions of that as well in global health. And also just to mention, there's my colleagues are also working on a project called the Smartphone Pandemic, which is a Norwegian Research Council funded project looking at the uses of smartphones across different countries around the world, the digital response to COVID. So back to my research. So one of the things that I'm particularly interested in my current research is looking at technologies that are not simply sort of produced for Africa or produced in Africa, but produced from Africa as well. And so I'm particularly interested in my region or my specific country that I'm looking at the moment is in Tanzania, and looking at following computer and data scientists, Tanzanian computer and data scientists, as they often self-teach, come from abroad to programs, and I'm following startup companies, university collaborations, particularly how they're using machine learning to design digital diagnostic devices. So pictures here on the left is someone using computer vision, machine learning for malaria diagnosis. The one in the middle is actually a foreign service or a German company. It's a symptom assessment, but there's also a Tanzanian company that I'm following, which is looking at how this Tanzanian startup is developing an app where you can put in your symptoms and using Bayesian or other types of machine learning statistical techniques, they'll come up with a differential diagnosis at the end. And that's meant to support rural health care workers with diagnostics of diseases. But one of the things I wanted to ask, I guess, from the speakers is there's one question I've changed just from people, the panelists that have spoken already. But the first one, which I was thinking about before, was we often hear about the digital divide. But what about the digital distraction is something that I wondered about, especially in my fieldwork, when I follow some of these digital technologies through to healthcare facilities in Tanzania. You find that there are a lot of them are, so for instance, in Tanzania, there was an electronic immunization record, which is being scaled up by the government, which was a sort of NGO, Gates Foundation program. But when you actually go to the healthcare facilities, the tablets are often broken. The cloud, the government doesn't have enough money to get by enough cloud capacity, so people aren't able to upload their data. And then there's all sorts of other health information systems that people are required to enter into computers. They might not have access to the computer, so they have to go to their healthcare, the district health authority to find a computer to fill that in. And I saw clinical officers missing all the time from their day job and queues of people as they were trying to manage the information overload, really, of filling in digital systems, but also often duplicated systems. So often, because they're unreliable, these digital systems, they're required to fill them in both digitally and manually as well, in a transition phase that seems to last years sometimes. And so this adds to the workload of healthcare workers that just don't have the capacity. So one of the questions was, what can development aid, I guess, and what can other people do about these sorts of distractions that digital technologies can provide? And the other question was actually something I was thinking about with the presentation earlier on about the role of the private sector. And I know that that's an important part that people think we need the private sector in development. And my previous research before I did my current research was on off-grid solar energy in Tanzania, and I spent a year and a half following around and hanging out basically with companies, foreign companies, who were hiring off-grid solar panels and systems on a hire purchase leasing sort of scheme to originally pour rural Tanzanians away from off the grid, where the grid was not going to come for a long time. And what happened is a lot of the initial funding for these companies was investment capital, and the profit, the shareholder motive wasn't as strong. But to scale up these companies, that they had these ambitions to grow, to beat the competition, they then moved to venture capital funding, and suddenly the priorities changed, and the more marginalized communities were no longer profitable, and instead the companies went to people that were just on the edge of the grid in cities who had the means to pay for these solar off-grid systems, while the other people often were left in debt as well, and sometimes had their systems repossessed. So I just wanted to raise, I guess, a provocative question about that, what actually happens sometimes when the private sector comes in into development situations. Yeah, and I'll stop there. Yeah, Joseph, I don't know if you want to.
No, I want you to address the question to Paul and Kim, and start the discussion. So please, and you've also seen the input from Rashid and some others on the Q&A, so you can pick them up. And Paul and Kim, please feel free to just jump into the discussion.
So I guess just to say, yeah, any of the panelists can answer any of our questions. I'll let you guys go ahead.
Good, thanks. I mean, if it's up for grabs, I mean, Kim, age before beauty, shall we say so? I start off and you continue. So I think these were very pertinent and interesting questions, and I mean, I find myself nodding a lot. So I'll just pick some of them. I think the issue of cross-sectoral, multi-sectoral work is essential. At the same time, it needs to be quite purposeful. So it really depends on what one aims to do, basically. So one needs to always have an eye on shall we say, on the target, on the results, on the, shall we say, on the intended outcome. But taking some examples, it's clear that working, for example, let's say within education, and I also cover education, I mean, it's clear that everything we do is about learning. I mean, no matter what we're doing in everyday life, any profession, any life situation, and so on. So it's clear, and COVID, the pandemic has shown that, I mean, when things get disrupted, I mean, and there are degrees of this disruption here. It's clear that digital solutions can, shall we say, provide an additional support. Sometimes they can even replace or even improve, shall we say, the quality of learning. So it's clear that simulation, what we've seen the past year in particular, is how do you cope when you cannot meet? We also know, because of the climate crisis in particular, I mean, we will need to change the way that we travel, that we transport ourselves, and so on. So that's one area, and I think that here there's a real opportunity for private and public sector, and I also really think that universities and shall we say, the fields that work with pedagogy really needs to be involved, because it's not a matter of just shipping or having a tablet. It's really about shall we say, how you learn. But here, both for self-help, for simulation of quite complicated interventions, there's one area that really needs several people, several disciplines, professions to work together. I think also around behavioral science, and I think, Christine, your intervention around health promotion is very clear. You need really to think through the local context and again, how people interact. We know the social pressures which can exist and so on. It's really go far beyond the, shall we say, the bilateral interventions or communication itself. It really goes into society, and the divide can really be expressed by, I mean, let's see what's happening, unfortunately, in Afghanistan just now in terms of girls and women. I mean, so it's just important to have, shall we say, the context along when devising interventions and possible solutions. Public services, it's clear that the example around HISP and health, we have now from NORAD's side, shall we say, exploring with the University of Oslo and partners, can one use, shall we say, DHIS2 as the platform that has been so successful within health management information systems, in education management systems? It's a totally different environment. The education sector, ministries of education are vastly different from ministries of health and care. And also there's a different community. Some things might be the same in terms of management information, but schools are not the same as clinics, and medical interventions are not the same as shall we say, learning interventions, both in terms of timeline and complexity. There are some similarities, but very different communities. And perhaps last, we've seen during the pandemic, the increase in social safety nets, the use of cash transfers. And here we see that, for example, the work that we're doing supporting ID systems, digital systems, is key. If you don't know where people live, if you miss out on the marginalized, I mean, ID systems is really a way of uncovering, shall we say, people, you and me, and so on. So I mean, it's clear ID systems is important, and also need to be linked up with financial systems. So I mean, it's clear here, and I'm sorry, I forgot almost the most important scene. I'm coming from the public sector, the policy side here. And that goes perhaps a bit to your question, Thomas.
Well, can we catch up with the policy later. I know that Rüdiger Kresch only has a very, very limited time slot. And so I remember your policy, we keep it in our eyes, but please allow me to introduce Rüdiger Kresch, the Director for Health Promotion at the World Health Organization. And Rüdiger, I looked up your impressive bio from GIZ, from your work all over the world, but in the interest of time, I would really love that you jump in directly and present the digital health promotion and community involvement as being some of the drivers of your work at the World Health Organization. The floor is yours, Director Rüdiger Kresch.
So thank you very much, Joseph, for your kind introduction. My sincere apologies, colleagues, for just jumping in at a certain point and then interrupting your very important discussions. So my sincere apologies. We're currently having the General Assembly of the United Nations, the UNGA, at the moment, and there's a lot of health issues on that, including digital health, the infodemic that actually accompanies the current pandemic. And so their digital health is very much on the forefront in the discussions in New York. And so thank you very much for allowing me just to jump in and then to jump out again. I usually don't do that. So thank you for giving me the floor to talk about digital health promotion and community involvement. And Brenda, thank you very much for operating the slides. If I can have the next one, please. Yeah, so to start off, my boss, Tedros, tells me that, of course, there are a lot of opportunities to use the innovation and technologies for health promotion, and that if then oversight and regulatory guidance is in place, digital health can be a powerful tool to building healthier, safer, and fairer societies. So we do see, however, that this is not a given. And so that therefore community engagement plays a crucial part in advancing digital health for better health outcomes. And if Brenda, if I could have the next slide, please, thank you. Yeah, so I will just very briefly talk about why we need digital health promotion, what it means to us, and how we are addressing it concretely in WHO. And we'll talk about a little bit about digital determinants of health and e-health literacy skills, and then give you a couple of examples. Brenda, thank you for the next slide. Yeah, so why digital health promotion? The numbers talk, we believe. So if you look at the overall population of 7.8 billion people, then about 5.2 billion, i.e. 66% of all use mobile phones, about 4.66 billion, i.e. almost 60% use the internet. And out of these, then 4.2 billion actually are active social media users. The next slide, please. We do see then that, number one, there's an increase in time that people spend on the internet and in social media. We see that it's younger people who use it more than older adults. And we see that if you look at why people are using it, it's very much to get the right information, to be informed about what's happening, to make contact with others. These are the main, if you look at the reasons for using internet and social media, that's the main reason for that. But then if you look at, you know, from April 2020, during the crisis, what have people used by and large? It's then very much, you know, streaming of films and movies. It's very much the entertainment business that has then attracted most of the people, and then also giving rise for a lot of blogs and discussions where health literacy will be an important tool, and community engagement will be important to actually counterbalance all the misinformation and infodemic that we're currently seeing. The next slide, please, Brenda. Yeah, so as you know, health promotion is the process of enabling people to increase control over and to improve their health. Control is a major word here. So how can I increase control over my health while living under certain conditions, societal conditions, and under circumstances that might increasingly be out of my own control? That is the big thing if we're looking at societies with innovation cycles that are ever more faster. Ever faster. And, you know, like in the 1990s, an innovation cycle in digital was about 20 years. Today, a full innovation cycle in digital is about 5 years. And what experts tell us working on digital health, on digital innovation, they say that in a couple of years, this total innovation cycle will only be 3 years. So we have an increased innovation, not only in digital, but in many areas of technology that actually change our daily lives. Like, you know, looking at that 50% use the internet and use smartphones has changed half of the world's lives. Just without what we're doing right now, just 3 years ago, it would have been impossible. So there is this increase in innovation. At the same time, there is an increase in complexity of societies, many more players, many more insecurities, many more challenges, so that life is not as secure, and for many, right? And the point therefore is, how can we embrace this change to use it for better health? How can we embrace this innovation and the speed of change for taking more control over our health, regaining the control that we might have lost? So therefore, you need health literacy so that you can make informed decisions about things in life which have an impact on health. And so that is where we actually need to move forward in health promotion. The next one, please. Yeah, so I guess I don't need to perhaps go into the differences of e-health, m-health, and telehealth. I think that's, given your profiles, I think that's all known. So, but just to say that we need, of course, to work across all these three. Next one, please. Yeah, as I said before, we are facing an infodemic. This was clear before COVID, but it's amplified during this crisis by offering instant and accurate information. That is the role that we play as WHO, obviously, but that we need to play as being in the public sector, being in the academy, in academic environments, and of course also as civil society organizations. Next one, please. So what can we do, and what can health promotion and community engagement do in this regard? We have a huge outreach as WHO, but given together all our partners, all our networks, like yours here now, we have an amplified, a much bigger outreach to people. So we can bring together community with common interests. We can revisiting different opinions and facilitate transparency and openness between participants. One of the things that we have learned through this infodemic, and also now the hesitancy in vaccination. I mean, there's many examples that we can bring forward, but this shows that you're no longer talking amongst different opinion groups. You're actually closing, and we've seen this in the Trump administration at the same time, people are talking to each other, but no longer between different opinion groups. And that is actually exactly the wrong approach. We need to bring together the different opinions and be more transparent about what drives different groups. Therefore, we can mobilize organizations and community members and offer opportunities to access health information, manage their health, connect and share with others. Next one, please. Yeah, so how to then digitalize a health promotion? We build commitment from countries to institutionalize digital health promotion into their national health systems. We develop a comprehensive strategy, promote the appropriate use of digital technologies for health, and recognize the urgent need to address the least developed countries. And if I may say, there is the word in the appropriate use of digital technologies. And for us, there's not only positive outcomes, and it's not only positive to increase the level of digital, but there's also a lot of risks attached to it. So who, for instance, says what sort of health apps are right, and who says which perhaps might not actually be beneficial to public's health? And there needs to be much more regulation and oversight in making sure that the information that people can access is actually accurate and true. And that's not a given at all. That's a big thing, a big open space for work of I think you colleagues, but you know, a lot of health promotion networks and other scientifically based networks that we need to promote. Next one, please. Yeah, so how to better involve communities? What can we do? We can benefit, so this can benefit people in an ethical, safe, secure, reliable, and equitable and sustainable way. If we are people-centered, evidence-based, efficient, sustainable, and inclusive, we can deal with cybersecurity, trust building, accountability, and governance if we are innovative and not only digitalizing the existing. We can maintain transparency and effectively communicate about the data security strategy if we're including and gathering input from communities, not only transmitting messages, but really engaging people in that. So the next one, please. So what are those determinants or digital determinants of health? There's the literacy in information, there's communication technologies, the access to equipment, the broadband and the internet. And then of course, we need health literacy skills, computer and internet skills, and skills for locating and appraising online health information. The next one, please. Let me give you examples of how we're using social media at WHO. As you know, in the health promotion department, you also, or we are working also on tobacco control, for instance. we have launched last year's industry strategy to actually get our children to use e-cigarettes. That's their strategy, because 8 million people die every year because of tobacco. So they're recruiting our children, and we've launched this campaign and had, believe it or not, 3.5 billion people who had actually seen this campaign. About 1 billion people interacted with us on this campaign, and over 500 million people actually communicated, retweeted, engaged in an ongoing campaign on this. This year's campaign is about cessation. Our aim is to reach 100 million smokers to make a consolidated attempt to quit smoking, and we're very confident that we will reach that number due to the social media campaigns we're having and the national campaigns with whom we work as WHO. Next one, please. Yeah, so yeah, we can skip that. I've just talked about it, but sorry. Then let me briefly talk to you about an initiative which is called Be Healthy, Be Mobile. That is an initiative that we've put up together with the International Telecommunication Union since 2012. We're working with governments, and we're reaching about 15 million people to date, not once, but we're engaging with about 15 million people. So you can see that there's a big, I mean, talking to you about the campaigns that we've just launched over social media, there's a lot then that we can still use in order to boost up those figures, those numbers in people. But what it is interesting is that we're giving interactive behavioral advice that also goes and it also addresses social determinants, for instance, and commercial determinants of health, so that people can make their choices based also on the conditions in which they live. So if I can have the next slide, please. Yeah, thank you. So therefore, we have a library of over 1,000 different topics in there that actually drive those communications forward. We have WHO health alerts during the COVID crisis, and a chatbot with Facebook Messenger to combat the misinformation that I was just talking about, the infodemic that we have. And together with Rakuten Viber, we also fight this misinformation with an interactive chatbot. Could I have the next slide, please? Yeah. So there's other examples I could give you, but let's not extend this too much. There's on mHealth, where you actually can look at events going on, and that you are you receive evidence-based information in classes of health literacy around the world. And the next slide, please. And I think I'm coming to a close, and perhaps we have a couple of more minutes for discussion.
Thank you so much, Dr. Kresch. I really appreciated that you jumped out on all your duties just to be here with us. And in the interest of time, I'll open up for one question to each of you, and then I think, unfortunately, the time is up, so that we need to conclude. So one question, Tom, Arunima, Christina, please.
Oh, I have a question. There was some questions on the Q&A about the political economy of digitalization, and your last slide mentioned working with Facebook and WhatsApp. And obviously Google and Facebook are building their undersea cables around Africa, and obviously gaining power. I wondered if you would be able to tell us anything about your experiences working with big tech and health promotion.
Mm-hmm. Yeah. Shall we collect a couple of questions, or do you want me to answer it straight?
Straight, please.
Straight. Indeed, it's not easy, isn't it? We have very few big tech companies who are really dominating the digital. So I'm Googling, I'm not Firefoxing, right? And there are other search engines which are extremely good, right? So how can we actually increase also the competition between the different organizations, number one, but number two, how can we regulate those companies that they actually do what actually promotes really democratization of countries and especially promote health. We do have special regulations with Google on this infodemic. For instance, that if you're Googling anything on health matters, that you will see WHO featuring on top of the search list always. There's many things that actually can be done to actually combat the infodemic, but your question about the political economy is absolutely vital. There's a lot of things that go much beyond what we as WHO can do, but where we can actually influence other colleagues in the UN system. Yeah, so I'd say it's a real important question which is not resolved at all.
Wonderful, and I think that brings us directly, Paul, sorry that I interrupted you when we talked about the policies, and I think the policies fit here in immediately. So if you'd like to jump in, and then giving the last question to Kim on the business in all of this, I think that would round up our session. Unfortunately, we can't answer all your questions in the Q&A. What we do is we collect all your questions. We ask our dear participants to give us answer, and we will collect them and present them on digitalglobalhealth.no. So, Paul, the floor is yours again on the policies.
Thank you so much, and I'll try to wrap up, also including some of the questions which came up. So I would say, and it's also an advice to the Center for Global Health and the new, shall we say, theme, cross-cutting theme. I think it's important when looking at digital innovations, digital solutions, we need to scale up the solutions that work so that they are taken up. So either they get to be commercial, basically, very clearly. So, I mean, there are clients, someone willing to pay for it and so on. Or else, like we've seen many places, many instances, the public sector needs to take ownership. And that basically is the key to have a sustained scaling up of digital solutions where there is no market at present. So I would really advise, one, if public monies are used for digital digital solutions, put them into the alliance, make them global digital goods, I mean, so that they can be reused and adapted locally and so on. And the second thing, and perhaps that speaks to your question, Thomas, around fragmentation. Yes, the health sector is fragmented. There are many projects, many programs, many donors and so on. The key is that government needs to take ownership, make, shall we say, solutions that are owned and have, shall we say, a timeline, so that one also can get behind them, both with public funding, World Bank, and donors, and finance them. We need basically a stayer will, a will to stay on and basically see interventions through. There are too many pilots, too many, shall we say, attempts at various levels of the health systems that are not fully funded. So it's clear here for me, the policy side is very important in terms of being, shall we say, successful in both choosing policy options, having the right framework, including around data security and privacy and inclusion, but also in terms of being able to scale up and make use of them.
Kim, where do the business fit into this picture? I mean, please.
Yeah, I think we already heard some of the challenges and the opportunities with business. So I'm not sure, it's not one answer to this question, I guess. But I think what I started out saying is that we really need to have a much closer cooperation between business and the governmental side, especially in health. I mean, we all know the challenges of that has already been raised here today, both on the do no harm perspective. But I think this is, I think the most important thing is to just strengthen that cooperation. And I think that most business want to do good and want to help, but it is, as have been repeated many times, it's very fragmented. And a lot of interest in their own products and services. So how do we interact between policy and business? I think we always come back to the same question. And if I look to Norwegian development policy, it's a huge gap compared to many other countries, how they're working between business and the public side. So I think this is the next step, and not a very interesting answer, but that's also the way it is. I would just say like we are working in the sort of real world, and there's no real simple answers, right? So
thank you for that entry point for the next and follow-up discussion, because when it comes to health, when it comes to policies, when it comes to digital public goods, there are so many open and not employed fields. So in a short summary, Dr. Kresch, when you introduced how good the campaigns from the World Health Organizations are reaching out to people, I would just recommend post the link where we can subscribe to these campaigns to bring them out further. And picking up that one from our director, Paul Pfeiffer, I really loved your contribution to dismantle the digital divide, which is not only on the access, but also on the skills. And certainly we've seen from some of the discussions the imminent impact of bringing health information out for knowledge uptake, and hopefully also for behavior change, though I doubt it a bit when I look at myself and the interest for some alcoholics like beer, being a German. So then coming back to the contribution from Director Gabrielli, where you clearly said there are 12 trillion US dollar in this business around the SDGs. And we need to be much more hand in hand working together to actually enable the use of the finances which are there. And by that one, then I close with the words of Christine Sverdrup, with just the little app which we created on the EDO app for Syria. We've translated it to more than 45 languages. We have over 100 books translated. We have campaigns translated. So I think that is the common interest for us to bring digital health promotion. And sorry for being a German, sorry for being 5 minutes late. I really apologize for that. And by that, I'd like to close this seminar and thank you all so much for your contribution here. Thank you so much. And I hope we see you again. And as I said, questions are going to be answered on digitalglobalhealth.no.